was born the year the NHS was founded in 1948. It was founded with the aim of delivering care for everyone, not just for those that could afford the care.
The philosophy of the NHS is not that it's about people's means, but it's about people's needs.
It didn't matter if you were poor or rich, you had access to it.
For me personally, it means a free service for all people, and especially for people like my granddaughter Lucy.
And I would like to see it continue to be a national health service, not to end up as it was pre-1948, where only those who could afford good health care got good health care.
I've worked in the NHS 31 years in April this year. Obviously I've seen the evolution of the NHS throughout all of that time. Our concerns now are about where the NHS is going, what's happening to the NHS.
I think the services are going to be affected in a huge way because the proposals that the government are putting forward with the primary care trust ceasing in a couple of years' time, we feel that patient needs are going to suffer.
What we do is give care, that is what we provide. And therefore, when cuts have to be made, often, or more often than not, the cuts are made at the coalface, at the delivery of care.
My area is really neurology, neurosurgery, neurosciences, and what I'm noticing is certainly with stroke services locally, we're not always being consulted about changes that might be being made outside of the organisation, which affect the throughput of patients through the organisation. People's rehab pathway may be cut short because they'll need to move possibly through the service quicker to allow for the next lot of patients to come through. It will have, in my opinion, a direct impact on patients' rehabilitation and their longer term quality of life possibly.
When you phone for an ambulance now, you're going to get a paramedic and a technician on the vehicle, which are both highly trained clinicians. I think in the future they're looking at having maybe just a paramedic with possibly just a driver. That's something that's been muted. So I think it's the care. That is okay if there's only one patient, the paramedic can deal with the individual, with the patient. But if it's a multiple casualty incident, you need more than one clinician there.
The government paper talk about care in the community. Care in the community is all very well, but I worked on an elderly care ward for years, and a lot of patients that came into us came in because they'd had falls, because they were confused, they'd picked up infections. They came into hospital and we soon got them on their feet and got them discharged. Now that's not going to be happening now. The white paper says these patients have to be looked after in the community, and in order to do that, they're closing wards. It's a cost-cutting exercise in my view. That is a personal view. I don't think it's going to work, and I think 10 years down the line we will see that this will not work and patients will die.
Well, I work in public health and we're sort of being treated slightly differently to the rest of the PCT. We have a separate white paper and separate plans. Hull is an area with a really high level of deprivation, and so public health work is really, really important, and it's made an enormous difference to, you know, mortality rates and the health of the population and reducing health inequalities, which is in essence the gap between kind of rich and poor and how that affects people's health and lifespan. Public health doesn't work on a nice 4-year election cycle with conveniently short-term results. Our Director of Public Health plans go up as far as 20 years, and that's looking at the adulthood of people that are at school now and so on. So that's what's been cut, the benefits to them later on in their life and to the population's long-term health.
Already we start to see more and more graduates finishing their course, and that they're not finding jobs to go to as readily as they used to. In the past, people could just they picked a certain number of jobs from a list of available jobs, and then the managers of the units where the jobs were offered them jobs based on their suitability for the placement. Apparently more and more people are having to wait longer now after they've graduated to get that position. It's causing a certain amount of anxiety amongst all myself and my fellow students as to what is going to be the case when we graduate. What are we going into? Will there be a job for us, and if so, will it be full-time, will it be permanent, will it be temporary? We don't know.
I go on the wards, and we have 17 mental health wards ranging from older adults to young people and children. So I go on the wards and sit and talk to people. I've also have responsibility for the staff as well, their spiritual care. Chaplains are disappearing as part of a cost-saving exercise in the NHS. And to get rid of that person, you're going to pay a lot more for counsellors coming in and bereavement counsellors coming in and this, that and the other. You aren't going to get the same level of service.
My granddaughter Lucy, who was born 10 weeks prematurely, and if it wasn't for the dedication of the nurses and doctors in the neonatal units and the special care units, she wouldn't be here today. And unfortunately she was a twin, and her twin sister died 11 hours after she was born, and Lucy survived, but only because of the good care that she received in the neonatal unit.
The changes are going to cost millions, in fact, and we believe that money should be better used to improve and develop the services that we currently have. The NHS is admired by countries worldwide, so we need to build on that and not keep constantly restructuring it. Well, most people won't remember what it was like before the NHS, but I think we are taking a huge step back, privatising the services. The NHS we're going to lose in 3 years' time, and we're going to see people with money being able to afford services, people without getting a second-class service.
The NHS was never set up to make money. It was about people and it was about care. It was never about money, and this is what this government want. They'll just want to open the floodgates so all the private companies will come in, and we just won't have an health service that we know and love. And we've got one of the best national health services in the world, and really we should treasure that. We need to keep our health service public, for the public that it was meant to be for. It's not about private companies.
PCTs are being dissolved altogether in 2013, in March 2013, and before then we're being gradually reduced and wound up. We've got a third of our staff leaving in the next week with redundancies, and the remaining staff are going to be merged into clusters with other PCTs in the region. So it's already fairly unrecognisable as an organisation to what it was 12 months ago before the general election. The replacement organisation is GP Consortia, which is not popular with GPs, and it's certainly not something that service users have been consulted about. There's no expertise amongst GPs for things like management and commissioning, which is what primary care trusts do. So the concerns that everybody has, including the BMA, is that they're not equipped to do it, and patient services will suffer.
I was around when GP fund holding came in. Some of the GP fund holders managed to set up a decent enough business, but they don't have the expertise to deal with the, I suppose, commercial side of things. They're there to treat patients, and that's what they should be doing, not dealing with the business side. Leave that to people, well, like me, who do know the business side and who do know what's best, and let them get on with the job that they do best. I don't want to go to my doctor and have him doing sums in his head before he says I can have my other hip done.
Privatisation has been creeping in through the back door for a couple of years now. In fact, in the white paper, it's clear that there will be a competition between the NHS and private providers. Patients are not aware of that. They won't want these sort of hospitals. They'll tender them out to private hospitals, and the terms and conditions for staff alone won't be as good, and the care potentially won't be as good for the patients. That's why we have such good care in the NHS, and we want to keep it like that.
The cuts in the services are going to start affecting me. It won't be long before I retire, and I'm going to need the care. As I get older, I'm going to need more care, and I worry that that care won't be there. It won't be a national health service. It'll be care provided as and when, and for those who can afford to get the care, by private companies. And it's such a shame, because the NHS was founded for care to be delivered at the point of need, not just for people who could afford the care.
We just want to keep the NHS public. We don't want it privatised. Nobody does. And I think the public need to be more aware of it, because they don't actually know what's happening. As long as they go, get their appointment, see their surgeon and get their operation, that's fine. But they need to know what's happening behind the closed doors.
they're actually going to just cut the health service into fragments. It'll be terrible. I really, really am against it, and I think we need to do everything we can and let the public need to know that we're going to lose one of the best treasures that we've got. It's our NHS. We need to keep our NHS.
I don't think that they will get the service that they've been used to over the last X number of years, because I don't think there's the commitment from a private firm to fit within the remit of what the NHS was set up to do. I mean, it was people-centred originally, and it was about providing service at a point of need, and I think that'll be dissipated if it gets to private companies.
The philosophy of the NHS is not that it's about people's means, but it's about people's needs. So to me, the more ethical thing to do is to deal with the whole population and make sure everybody's needs are met. And that's not done by profiteering.
The NHS is going to be, rather than be free at the point of contact, it's going to be more pound and pence driven rather than clinical care.
We went out to America and talked to hospital managers, and they were amazing, both men and women, and they were saying that because of their healthcare system, which again isn't like our NHS, they could only treat up to when the money ran out. And when the money ran out, the person was discharged, and it didn't matter if the treatment wasn't finished. And one lady actually said to us, she discharged somebody onto a grating in the street because it was warm at least, and the staff would give them something to eat as they went out. I don't want that for our health service at all, and I think that's where we would go if it was all fragmented.
The general public need to be concerned again, because they don't realise what they're going to lose and what things might actually look like in the future. And I think that's a real concern, because it doesn't appear that, you know, anybody's really saying to them, you know, maybe you're going to have to pay more for things, maybe you're not going to get what you want. How do you get the care that you need? How can you be assured that, you know, when I'm in another 20 years' time and might be needing something, you know, am I going to get it? And I think that is a real concern.
Well, the general public managed to rise up and save the forest, and I really commend them for that, because they needed to do it. The general public should see that the NHS is every bit as important as those forests, and fight for it, because it's them that use it and need it and work in it. It's all of ours.
Even now, the general public don't think of the NHS as something to do with money. When they go to see the doctor or the OT or the physio. They don't see it as going somewhere where they're going to spend money to make them better. They're just going to be made better. Does that make sense? And I think that's where the cracks would come if they started seeing it as, well, I've got to go to the doctor and I don't know whether I'll be able to do anything because I don't know whether there's enough money in the pot. Right now, we are still a national health service, and I think that if it once goes, there isn't a way back.